The 18 Strong Podcast, episode number 106 with Dr. Andreo Spina.
How much of that flexibility do you own? How much can your nervous system call upon at any given second of the day? That's mobility, and that's what I care about. I call flexibility useless because it's only good if you want that beautiful picture for Instagram.
Welcome to the 18 Strong Podcast, where you get direct access to the world's greatest experts on training harder, practicing smarter, and playing better golf. Now, here's your host, Jeff Pellizzero.
Hey guys, what's up? This is Jeff Pellizzero. Welcome to the 18 Strong Podcast this week, where we have a very special guest. We have Dr. Andreo Spina, who is the creator of Functional Range Conditioning, otherwise known as FRC, as well as Functional Range Release and the Kinstretch courses, all three of which are courses that are really kind of blowing up around the nation and really around the world as far as training and educating clinicians, medical practitioners, and fitness professionals on what the research is really showing as far as the best and most proactive ways of improving mobility, improving strength, and really kind of going about it a little differently than the traditional, stretching techniques that we all kind of grew up with and have seen for years and years and years. And it's his differentiation between flexibility and mobility that really have put Dr. Spina on the map as far as looking at things a little bit differently, looking at it from a little bit of a different angle based on what the research has really shown. And I think this is very important for the golf community, because traditionally people come into the clinics, or a big complaint that you have is, I need more flexibility. I need to be able to rotate more. I need to just be stretched out. I can't tell you how many people have come to my facility and asked me if I will stretch them out. And what Dr. Spina does so well is differentiate that what mobility versus flexibility really means, and why what we traditionally have been doing is really just possibly working on creating what he has termed useless flexibility. Because if somebody can push you into a certain motion or to a certain position, but you don't own that position, you can't do that on your own, it's not going to translate over to whatever your sport is, whatever task you have at hand. Or if you're in the middle of a street and you got to jump out of the way of a car coming crashing down the street, is that flexibility of somebody being able to stretch your hamstrings going to help you out, or do you need to actually own that? And that's kind of the premise of our conversation today, of how he came up with the system and what we need to do on a daily basis in order to, as he puts it, treat our motion and our mobility like we do brushing our teeth. It's just another habit that we have to develop in order to live as stronger, more competent, not only golfers, but human beings. So I think you're going to get a lot out of this interview with Dr. Spina. Real quick, before we get into the interview though, I want to tell you a little bit about the private community that we have put together. We're actually using Facebook as a platform. It's called the Bogey Proof Lifestyle. And what we've done is we've created an interactive community where the 18 Strong listeners, 18 Strong viewers can come and join us in our coaching program, where we've got tons of resources as far as where to start with your fitness program and being able to ask questions and things like that. It's a constantly growing community of resources. There's weekly content that we put in there, like different exercises and circuit workouts, and we've even got a weekly challenge that we put out every single week to kind of hold everybody accountable to what they say they want to do, to working on their fitness, nutrition, and just improving the lifestyle around golf. And that's why we call it Bogey Proof Lifestyle, because we know that playing golf is a goal of all of ours, but to be better, be healthier, be stronger, be more fit, that also ties into the lifestyle of the game and what you're doing on a daily basis. So it's about more than just golf. While yes, that's a huge piece, it's also about the way that you're living on a daily basis, which I think goes straight into what Dr. Spina is talking about on this podcast, as far as utilizing daily principles and just short bits of time in order to improve your body, improve your health, which obviously will improve your golf game. So if you want to go check that out, you can check out the video that we put together on 18strong.com/BPL, like Bogey Proof Lifestyle, BPL. And you're going to hear kind of a cool and crazy story about Ryan, my partner, my cousin in this whole endeavor, and kind of how things changed in his life regarding his fitness, his health, his golf game, and another reason why we wanted to create this community and why we're kind of building this platform of 18 Strong. So go over there and check that out. If you would like to join us, we'd love to have you. It's been great getting the feedback from some of the individuals and getting to meet people that I know listen to the show, answer their questions, see where they're golfing on a weekly basis. We try to keep it as a fun, interactive community where we're all benefiting from the lessons and experiences of others, not just us and our coaches creating content and videos, which is obviously what we're doing a lot of, but also interacting with everybody in there because everybody's had their own troubles, their own experiences where they've failed or they've succeeded, and we know that everybody can benefit from those. And so it's been very, very cool. Quick shout out to two of our members in the group, Tamara Kobiani, for getting her first hole-in-one ever, and also our buddy Danny Muniz, who played his first round of pain-free golf, as he mentioned, after starting to listen to the podcast and joining the Bogey Proof Lifestyle group and taking advantage of some of the resources in there. So if you want to go check that out, 18strong.com/BPL. All right, time for the man of the hour, Dr. Andreo Spina. I know you guys are going to enjoy this one, so let's bring him in. Hey, Dr. Spina, thank you so much for taking the time to come on to the 18 Strong podcast.
Yeah, thanks for having me.
Absolutely. I've seen so many things on your posts on Instagram and talking with all the different professionals that we've had on the show and that I work with and connect with, and so many of them have said that the functional anatomy seminars has really changed their perception in what they're doing in their clinics and how they're working with their golfers. And so I'm really excited to dig into the flexibility and mobility aspect and all the great stuff that you're doing, but I want to get to know a little bit more about your background, where you came from, because just like anybody that's doing great things, all of a sudden we start to see a lot of their content and posts, but it seems like you have just really exploded, and I know that's never the case where somebody just comes on the scene has exploded, but so give us a little background on you, where you grew up, maybe what sports you played, and how you got into this whole world.
Sure. I grew up in Toronto, Ontario, Canada. That's where I reside now. It's where I have my sports medicine clinic. I suppose the career started from, like you said, like what sports or activities you did. But I've been a lifelong martial artist, so I've been studying martial arts since I was, I'd say, about 5-6 years old, and I've studied various disciplines. And if you were to ask me, one thing that got me into the profession, I suppose it would be kind of dealing with the training and the injuries and whatnot that come along with doing mixed martial arts over the years. And then from an early age, I knew I wanted to do something along the lines of sports performance or injury management, etc. So I studied kinesiology at McMaster University in Hamilton, Ontario, Canada, and then following that, I got into chiropractic, so I did my doctorate in chiropractic, and then I finished a post-graduate fellowship in sport chiropractic, so sports specialty chiropractic, as well as all the training, personal trainer, this, and strength and conditioning specialist, that type stuff that you add on, so I guess that's where we are now. So now I'm in Toronto. I own a sport medicine clinic, multidisciplinary clinic, but most of my time, as you know, is spent traveling and certifying people in my manual treatment as well as training systems.
And what kind of disciplines did you do in martial arts?
Various ones. I began in judo. I went into taekwondo. I got a few black belts. My second black belt was in Kempo karate. I've been doing Muay Thai and jiu-jitsu now for a good number of years. So kind of a whole mix of martial arts. I've done quite a few of them over the years. Did
you start at a very young age doing that?
I did, yeah. Like I said, I was, I want to say around 5 or 6 years old. That's when I first started in judo, and then I went right into taekwondo, and then that parlayed into Kempo karate. And then from there, the whole, I was there before that whole mixed martial arts scene, so the idea of mixing things was like was not exactly popular. But I was mixing it up right from the beginning, and then as soon as the whole mixed martial arts thing came on, then I started with Brazilian Jiu-Jitsu, as many martial artists had done.
And then from a professional standpoint, when you got your chiropractic degree and started working more in the clinical side, were you still working with a lot of martial artists? And did you kind of start delving into other sports as well, or was martial arts kind of the main thing?
You know what? If I remember back, I can tell you I played this hockey and soccer and did all the other things that most people do. But the martial arts was really my main focus throughout the years. So I dabbled here and there, but mostly martial arts. And then, I mean, from that, martial arts, in my opinion, is one of the most. It's an incredible way to learn human movement. So I suppose that kind of started me along this lines of, how do I get people to move better so that they can accomplish whatever goal that is that they want to accomplish? So I guess we'll get into it, but now I work with any variety of athletes using my systems. It doesn't really pertain to one particular type of activity or one particular sport.
Gotcha. And so, as you're working with all these different clients, obviously I see a lot of very interesting different movement patterns. And when did you kind of start to realize that what was being traditionally taught was not necessarily getting the job done? And when did you kind of start to develop your own system? And where did the FRC and the functional anatomy seminars kind of stem from?
That's a real good question. I guess the best way to answer this is there's a lot of acronyms that I have in place to kind of explain the system that I use. But it's the best way to think about this is what I teach. So everything from functional range release to functional range conditioning to functional range assessment to kin stretch, it's all one continuum. It's all one system. So the system was kind of spawned out of how do I properly manage the physical well-being of another human being, all the way from assessing what's wrong to treating what's wrong to training and preventing things from going wrong in the future. I guess all of that started on the therapy end, and if I were to pinpoint it, I spent a lot of my time teaching in the cadaver lab in chiropractic school. So the first inclination that I thought something was going wrong was when we were being taught anatomy, dare I say, out of a textbook. Even though we're working on cadavers, the way we were taught anatomy was this very cold, dead memorization method where, you'll go into a cadaver room and people put pins in a cadaver and you're supposed to say that's the ulnar nerve and that's the bicipital tunnel. But it was just identifying structures as opposed to understanding how those structures actually function in the living body. I always make a joke that most therapists and trainers are experts at dead person anatomy. But dead person anatomy is not the same as living tissue. And I felt from early on in my career that we should be learning how to physically touch, assess anatomy in the living person as opposed to just memorizing all of these, structures and their Latin names. So it started off really with I put out a course teaching people how to palpate, how to actually put your hands on someone, and when you're touching someone and feeling their tissues and how they're moving, I first thought we never really were taught how do you interpret what you're feeling. So the whole thing started for me trying to get across in a systematic way how can a manual practitioner specifically localize anatomical structure and then subsequently make decisions based on their palpatory findings. Once I started teaching that, the next general question was, all right, well, once you've found it and you can analyze what's wrong, what do you do to treat? And then I ran into another problem. And the problem was that if I looked at the most recent treatment methods and I contrasted that against the literature, what the actual scientific research says about applying force and how the body's tissues adapt to force over time, I realized that there was a mismatch. So in other words, people were doing these manual treatments and expecting these results, but the results and the treatments didn't comply with what the research was saying. So pretty much the functional range release soft tissue management system was spawned out of me not being happy with what was there. So instead of just the way that soft tissue treatments work and in general how it's kind of like passed on. So like you have this guru person who does it a certain way, and then the student kind of adapts what the guru person did, and then it goes on and on and on. I tried a different approach. What I said was, well, what does the research tell us? And based on what the research says, am I able to pull out a system from the research? Mm-hmm. And in so doing, the functional range release system was created. And then again, you start teaching now. You're teaching the palpation, you're teaching the assessment, you're teaching the treatment. The next thing people would ask, how do you rehabilitate, and then how do you train? And then I went through the same process. What can I gather from the research? What does the research tell us to do? How do we keep joints healthy? How do we keep them functioning properly? How do we increase people's movement capacities? And if you ask me, I'll tell you that the research has all of these answers. All I did was kind of interpreted what the research was saying and put it together into a systematic approach to managing people. So that's where functional range conditioning came out of. So that takes care of how do I rehabilitate, and then moving forward, how do I increase someone's body control, movement capacity, prevent injuries, increase mobility and agility, etc. So that brings us to here, and then I can go on and tell you that the new system, Kinstretch, kind of was spawned out of FRC. People would ask me, if I'm using FRC principles on my clients one-on-one, how do you go about putting together a group class that can work on body control, mobility, etc.? And that's where Kinstretch came out of. So that's kind of where we are now. I'm pretty confident that I've kind of covered all the bases. So the whole thing, I call it the functional anatomy system, which includes the assessment, the treatments, the rehab, and the training.
Yeah, it sounds awesome. And like I told you before the call, I can't wait to get to one of your seminars in the near future. I think there's one in Chicago that I'm looking for dates to see if that works out. So what was it that you were finding that people were doing incorrectly or doing wrong that wasn't effective, that you then looked at the research and said, hold on, that doesn't make sense, what we've been doing forever, or what we've been doing for a long time, or it has been passed down. Why don't we do it this way? Because this is what the research is showing.
You know what? I've answered this question on many podcasts the same way, by going through what the first step was to building this. But I think it's better answered in this way. When I've had over my career, because I'm a manual therapist and a trainer, I've had the benefit of seeing both sides of the equation, seeing people training and then seeing them get injured, taking them through an injury, back into training, watching them go back to training and get re-injured, and this cycle keeps going on and on. And at some point, I began to realize that people are arguing over, what exercise do I prescribe, or who invented this exercise, or what's the best way to generate power for this particular athlete, et cetera, et cetera. So they're always looking on the side of, what should we do with you? What should I assign you? And I think right off the bat, in my mind, there was a huge and glaring error with that approach. And the error was, maybe the problem isn't in the exercises we're assigning. Maybe it's the actual physical body of the person who's performing the exercises. And that's kind of where this whole thing started. So in my perspective, I don't consider any exercise to be good or bad. People will say, what's the bench press? Is it good or bad? And people blog for days on this, talking about, don't do this, or don't do this. I don't really give a shit what you decide to do. What I care about is, do you have the joints and the body control to be able to accomplish your goal safely? So that's kind of the difference between what I do and what other people do. I don't invent exercises. I mean, a lot of people come to the course, and I'll tell them right off the bat, please don't go on Instagram and say, I learned this new FRC exercise, because there's no such thing as an FRC exercise. FRC, it's a thought process. And the thought process is, you have to analyze, what is the person's goals? What do they like to do with their physical life? And then we decide whether or not their body and their joints are prepared to do what they're asking their body to do. And when you look at it in this context, and you start to assess a word that I feel is not utilized enough in the training, in the gym, prerequisites. When you start to see, do people actually have the prerequisite to do these exercises you're assigning, it's glaringly obvious that people are doing things without being prepared. So a great example is a squat. You go into any gym, and the trainer goes, squat's a great exercise, builds power, da-da-da-da-da, it's good for this, good for that. So we're going to do squats. And then you start squatting. Then as you start squatting, you start realizing, my right knee hurts and blah, blah, blah. And then you start to question yourself, is squatting bad for your knees? And I really think it's the wrong direction. What I do is I bring you in and I say, okay, so we have a squat here. Is the person in front of me, do they have the capacity to get into a squat position under load? And can their tissues, are their tissues resilient enough to be able to train in that position before we actually get them to do the position? And that really is the key to my systems maybe versus what other systems are putting out there. It's I'm preparing the body to do, whereas many other systems, they're just worried about what they're doing.
Right.
Mm-hmm.
So when you bring somebody in, you have some different, obviously, assessments that you go through. You've got different prerequisites that you look at for different movements. And before you say, hey, we're going to do a chest press, or we're going to do a squat, or we're going to do a lunge, or whatever, you make sure that different. Do you look at them body part by body part, or do you kind of go through a flow of movement? Or
It's actually it's both, and it's a very good question because there's assessment systems that are watching people move, and then there's other systems where you're kind of taking joint by joint and looking at the capacity for the joints. I do both. So right off the get-go, I don't care about how you perform a particular movement if your joints don't have the prerequisites to accomplish that movement to begin with. So I won't sit and watch someone do a squat with their arms over their head before I know whether or not their shoulder actually can forward flex to get their arm over their head. Sounds really funny, right? Because I'm saying somebody comes in and they want to do, let's say, overhead presses, and I will ask them if they can put their arm over their head. And people think, oh, yeah, everyone can put their arm over their head. But really stop to watch the next 5 people that come into your gym or the next 5 people. Ask them to put their arm over their head and watch the way the body accomplishes that task. And what you see is incredible amounts of compensation. So a lot of people might flex, just past the 90-degree point, and then you start to see that the rest of that flexion is not actually coming from the shoulder. It's coming from, let's say, hyperextension at the lumbar spine, or extension at the hips, or whatever it is that their compensation is. You can see it just by asking someone to lift their arm over your head. Now, a lot of people would say, just, forget about that. As long as you can get your arm to this position, go ahead. But the problem is when you start to throw weight above your head and the majority of the movement's actually occurring at your lumbar spine, well, then you start to overstress the lumbar spine in order to protect the shoulder. You know what I'm saying? And then this cascade of events starts to happen, which can be devastating. So first things first, do your joints do what a normal Homo sapiens joints should do? And I believe that there's an answer for that for every single joint. If you give me a shoulder, I can define what normal shoulder function is versus abnormal shoulder function, and we'll start there. If the answer is the shoulder is abnormal, then the most important thing in my mind is to give them a normal shoulder. Forget about increasing power and proprioception and flexibility and blah, 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 blah. Does their shoulder work like a human shoulder should? If the answer is no, then that becomes the most important thing to accomplish before any other goal is actually attacked or however you want to say it.
Gotcha. And so what if you have somebody that maybe they're in, let's say it's an athlete, a hockey player, or a golfer, obviously let's pick golf, somebody that has to perform, and you come across and you find that, hey, there are compensations all over the place. We need to allow you to perform ASAP. I know we're not going to be able to fix that joint just yet. Do you still just focus on fixing that component, or how do you get around that?
In the perfect scenario, someone comes to me and they say, I want to train, and I look at them and say, well, here's 3 months worth of pre-work before you can train. Clearly, that's not the way that life works. If I have one of my pro athletes come to me and they have a tournament next week and they say, my shoulder's messed up, a week is not a substantial amount of time to make that shoulder function properly. So in that case, I rely on my manual treatments. We rely on the other things that many people do in order to get them past, the next few competitions or the next training. But while we're doing it, I teach people how to layer in or program in correction work into their, already well-established program. So it's not like I would tell, I have people coming out. I'll give you an example. I'll have a power lifter come in. I mean, power lifters do three things. They squat, they bench press, and they deadlift. I can't exactly tell a power lifter, you don't have the movement capacity in your lower lumbar region to squat, so just you can't squat. Right? That doesn't make any sense. Clearly they have to squat. But just knowing that I know where their problems are, and in the midst of their training to squat heavier, I'm making corrections, that's really the key. And that's I guess the hardest part of FRC is the programming part. How do I make the changes I need to make efficiently while still maintaining their other energy systems or still maintaining how their level of function?
Right.
Mm-hmm.
Let me shift gears here just a little bit, because I know we're a little crunched on time, and I want to address the whole flexibility and mobility issue, and especially for the golfers that are listening. Many of them, they initially say, I'm lacking rotation. I need to be more flexible. I need this. I need that. But I read a great article that you wrote called, I think it was Dismissing the Flexibility Myths, something along those lines. And you talk about the idea of, first of all, useless flexibility. But so if you could maybe describe that, and then also just kind of touch on flexibility versus mobility.
Sure. So there's two different words for a reason, right? The problem becomes when people start to use them as synonyms. I'm working on my flexibility becomes I'm working on my mobility, becomes I'm working on my agility, and nobody really has their definition straight. So the way that I'm not going to go through the definitions of the terms, but just generally, when someone's saying, "Hey, I'm flexible," what you're saying is under under an external load. So whether it be the personal trainer pushing you down, or you using gravity to pull you down, or you're grabbing your foot and pulling yourself down, what you're demonstrating is the ability to change body position passively. So when an external load is put into the system, I can achieve this particular body shape. Now, what people get confused is assuming that because you can do it passively, that magically the nervous system will understand how to get you to that position using your own internally generated force, i.e. movement. And that's where people are completely wrong. Just because you can do a passive split, I'll give the example of fighters, it doesn't mean that you can kick someone in the head, right?
Right.
Getting into a passive split is one thing, but then when you have to actually lift your leg and rely on the muscles on the opposite side, so in the terms of, let's say, a side kick, you're asking your glutes, can you function in a very shortened position? And unless you specifically train your body to function long and function short, just garnering passive flexibility will not give you these abilities to use that flexibility in movement creation. That's where mobility comes in. So mobility is the ability to change a body position actively. So I can bring myself to this particular range, or I have live access to that range of motion where my nervous system can control my body in that range. It can produce a maximal amount of force in the event that I need to prevent injury while I'm training or working in that range. And it's a huge difference, and it's a difference that not enough people are accounting for. You can look awesome at the end of an hour-and-a-half yoga class. You can be in a full split, wrap your leg around your head 10 times. That's amazing. But the next day, when you're walking down the street and a bus is coming at you, you don't have an hour-and-a-half to get all yoga'd up. You got to get the hell out of the way. And that's your mobility. How much of that flexibility do you own? How much can your nervous system call upon at any given second of the day? That's mobility, and that's what I care about. I call flexibility useless because it's only good if you want that beautiful picture for Instagram. But it's not going to help you kick someone in the head, or it's not going to help you with your golf swing. What helps you with your golf swing is, can you control your spinal segments? Can you move your pelvis into the position that is required in order to achieve a proper golf swing? And those are two different things completely.
I know this is going to be it can't be a quick answer to a question, but what are some of the best ways to do that? And I know we've had people on here talking about some of your terms that you use, the cars, the pails, the rails. So if you could maybe kind of explain those a little bit, and then also just maybe give us in these last few minutes here an idea of what can the general person do. Is it a daily routine? Is it a weekly routine? That type of stuff.
Sure. Yeah, I get this a lot online where someone says, "Well, where do I start?" And what do I? The problem is that my systems are geared towards individual people. So that's why my seminars are certifying health professionals or trainers to be able to utilize the concepts on, let's say, the weekend golfer. You know what I'm saying?
Mm-hmm.
So yeah, there's a component of cars, for example, controlled articular rotations, which to the layperson just looks like joint circles. There's layers upon layers upon layers of cars, but just to generally explain kind of what we do, there is a daily maintenance of joint health that is required. I'll always say that difficult movements are made much easier when you have healthy joints. And the only way that we know of to really keep joints healthy is to continue to move them. So we have morning routines where FR practitioners or people who are training in the system, they get up and they'll do their joint exercises just like you would brush your teeth. So there's an entire component of keeping the joints healthy and maintaining what the joints are doing at this moment. Then you have this other area where we're looking at what exercise do I need to assign in order to achieve a goal. Let's say, for example, like I said before, you need to lift your arm over your head, but it just doesn't get there. Well, I know that would put you right into what we call pails and rails, or progressive and regressive angular isometric loading, because that particular approach gives me a very specific outcome, increase range. Once the range is increased, now I got to go back and I got to make sure your nervous system can control those ranges, and that's when you get more acronyms. Passive range holds, passive range liftoffs, end range rotational training. These are techniques that we use to try to teach the nervous system how to control the ranges that we're expanding. It gets really confusing to the layperson, and people have often, I see it online, they're like, all he's doing is making acronyms to make things confusing, and I'm really not. It's because I'm not showing anybody exercises. What I'm showing you is a thought process. If this is the finding, then you have to invent a passive range hold exercise that will give you the desired result you need at that time. There's no other word for a passive range hold exercise, so clearly I had to make one up. Does that make sense?
Yeah, absolutely.
I'm not trying to make a convoluted system of acronyms that only, like a secret language. I've seen that. It's really not that at all. It's just I care very little about exercises. I care a lot about how do you decide which exercise to give at a very specific time. Now you're probably going to say, how does that help your listener? Of course, I would say, the best way to do this is to find an FRC certified person or to find an FR certified person and work with them. But in terms of daily maintenance, I mean, if you don't have a morning routine where you kind of go through and move all of your joints every morning, almost like warming up for your day, then I can pretty confidently tell you will not maintain your joint health. It's almost, the research is almost as clear-cut as that. If your joint stops moving, as soon as that happens, degradation of the joint's tissues occur. So if you have compensations, if your shoulder doesn't do what you want it to do, golf, give you a better example for golf. If your lead hip cannot internally rotate, okay, and you fake internal rotation by torquing out your lumbar spine, you're going to injure your lumbar spine. I always say if a golfer has back pain, look at their hips. If they have hip pain, look at their back. Now, if your lead hip does not internally rotate and you continue to golf, I don't care how much glucosamine you've taken. I don't care how long you've been on your foam roller. I don't care how beautiful or how far you can swing that golf club. Your back will have to take the insult from that hip not moving, and your back will eventually wear out. So the best advice I can give someone is every single day of your life, your warm-up should start just after you wake up, and it should end approximately just before you go back to sleep. And that's what's needed in order to maintain a good, functioning, healthy body. And people will say, that's crazy, no one can do that anymore, everyone has a job. And to that I say, that's not my problem. Like, I don't make the rules. The rules are kind of set out by evolution, millions and millions of years of evolution. And millions of years of evolution tell us that right now, instead of being on the phone speaking, we should be hunting and gathering, which means we should be out there moving in different lines, different directions, crawling, jumping, using strength, power, flexibility, all of it on a daily basis. Contrast that to the average human's lifestyle, and you understand why it's so just necessary to constantly work on joint health, right? It's just like brushing your teeth. The exact same the analogy is used over and over. But everyone's all good with brushing their teeth to keep their teeth in their face. But, nobody wants to do a 10-minute warm your joints up for your day routine. So that's first and foremost where the system starts. It's get your joints healthy.
I love it. And I love that it's not my problem, because it's so true. We can fit so many other quote unquote priorities into our day.
Sure.
It's just where do we really put those priorities? Dre, I can't thank you enough for the time today. One last quick question. It's a one answer question.
Sure.
Are you more of a Caddyshack or Happy Gilmore fan?
Oh man, Caddyshack for sure.
All right, I love it.
Yeah,
the audience would have been mad if I didn't get that question in there.
Yeah.
All right,
absolutely.
Man, I really, really appreciate it. I'm going to link up all of this stuff where people can go to your site to find an FRC or FR certified trainer or fitness professional in their area. We'll also have a lot of different links to more information about you guys where everybody can get the info. Thank you, Dr. Spina.
Bye now.
Thank you so much for joining me on the 18 Strong podcast this week. If you want more information or any of the show notes, just go to 18strong.com and you can search for Dr. Andreo Spina, or this is episode number 106, and you can search for it that way. If you haven't subscribed to the 18 Strong podcast on iTunes, what are you waiting for? Just go on over to iTunes, click subscribe. That way you'll get every single new episode right in your inbox, or actually on your phone, wherever you listen to the podcast, and you'll have it right there. If you want to go check out our private interactive group on Facebook, like I said, the Bogey Proof Lifestyle, go to 18strong.com/BPL and come and join us with all the fun over there. It's a great community. We are growing every single day, and I have a feeling it's not only going to change a few golf games, but a few lives as well. So come and join us. We would love to have you. Till next week, train hard, practice smart, and play better golf.
Thanks for listening to the 18 Strong podcast at www.18strong.com. And remember, train hard, practice smart, and play better golf.